Now, this is a very commonly asked question or very commonly asked clinical entity, that is, how do you define a rheumatoid arthritis, or how do you label someone that the patient has rheumatoid arthritis, or what is the diagnostic criteria for the rheumatoid arthritis? Now, the most simplest definition for rheumatoid arthritis is the presence of bilateral, symmetrical, inflammatory polyarthritis, which has to be there at least for more than 3 months. And so, whenever we call it as bilateral, it has to involve both sides, means bilateral upper limb or lower limb. It has to be symmetrical, means it has to involve both sides. It has to be inflammatory. Inflammatory means where there should be pain, where there should be swelling. So, whenever we say that as it is an inflammatory disorder, it usually commonly gets relieved in summer season. The pain is slightly better in summer season, whereas it markedly increases in winter season where the temperature is less. So by inflammation, we say that there has to be pain, there has to be swelling, there has to be tenderness, so that whenever we press those joints where the patient has pain, the pain should increase whenever there is palpation. And it has to be polyarthritis, means it has to involve at least more than four joint. Now, to label someone as having a rheumatoid arthritis, the patient must fulfill six score. So we have to give a scoring system which is by Eular criteria, that is European criteria, whereas the patient should acquire at least six or more than six score, and we can label that the patient, yes, the patient fits under rheumatoid arthritis. So the most important thing is involvement of joints. So we have to give a score depending on involvement of the joint. So if there is only one large joint involvement, we give a score of 0. If there is involvement of 2 to 10 joints of the body, where there is primarily involvement of the large joint, then we give a score of 1. If the patient has involvement of 1 to 3 small joints, then we give a score of 2. If the patient has 4 to 10 small joint involvements, then we give a score of 3. And if the patient has more than 10 small joint involvement or 10 joints involvement, where there can be involvement of large joint, we give a score of 5. So depending on this score, we can simply pick up a score based on the involvement of joints in the patient. The next thing is presence of serology. So what we commonly need is we need to do rheumatoid factor and anti-CCP antibody. If these factors are negative, we give a score of 0. If these are less than 3 times raised, we give a score of 2. And if they are high, that is more than 3 times involvement of these factors is there, we give a score of 3. Next is presence of acute phase reactants like CRP and ESR, which are actually inflammatory biomarkers. If these are normal, we give a score of 0. If these are raised, we give a score of 1. And one of the most important thing is duration. If it is less than 6 weeks duration, we give a score of 0. And if this is more than 6 weeks, we give a score of 1. So for example, if some patient is presenting with suppose bilateral joint pain since around 6 weeks, so if the total joint involvement in the small joint of hands, if it is around suppose 12, automatically there is involvement of the more than 10 joints, so we give a score of 5. Next, if the patient has this symptom since 3 months, 4 months, that is more than 6 weeks, we give a score of 1. So 5 plus 1 automatically becomes 6. We can label that the patient has rheumatoid arthritis. We don't need anything else. If we do acute phase reactant, if it is raised, then we add a score of 1. So automatically it will become 7. So it's very important and interesting criteria to label the patient to have definitive rheumatoid arthritis. That's all for now, and thank you.